Hello everyone, my name is Beatrice Kamau. I'm a pharmacist and public health professional working within Nairobi. I currently serve as a sub-county pharmacist where I support facility teams in medicines management, data use, and supply chain decision making. Today, I will share my leadership project, which focused on strengthening data-driven decision making to improve availability of essential medicines, particularly for maternal and child health. So I work in a sub-county with 11 public health facilities spread out across 4 wards. And in many of these primary healthcare facilities, data exists, but it is not consistently used to guide decisions. Ordering of medicines is often not based on consumption trends or stock on hand data. And at the same time, these facilities are now operating in a changing financing environment here in Kenya, with provider reimbursements under the Social Health Authority. These facilities have greater autonomy over what they can procure. And without strong data use, there's a real risk of inefficient spending. So the overall goal of my project was to improve the availability of essential medicines and supplies in a Nairobi sub-county by strengthening facility-level data use. And the core objective was to establish a culture of data-driven ordering and routine data review at facility level, shifting teams from dependency to ownership. So we implemented this through several concrete activities. First, we conducted capacity building sessions on forecasting, supply planning, and interpretation of routine data. We also provided continuous mentorship, recognizing that learning does not stop in the training room. Thirdly, we supported facilities to shift from arbitrary ordering to data-informed planning. However, like any other system-level project, we faced some challenges. For one, staff had competing priorities and limited time. There were no dedicated resources for mentorship or routine data reviews. And facilities were navigating multiple digital platforms, increasing their data burden. There are also system downtimes, occasionally disrupting reporting. These challenges strengthened my adaptive leadership because they required flexibility, partnership, and a focus on progress rather than perfection. Within a short time, we have observed some encouraging changes. There have been an increased availability of essential medicines, improving by over 50%. There have been improved data accuracy and reporting timelines, and facility teams have demonstrated greater ownership of their data and decisions. And in October 2025, the sub-county was recognized by county leadership for improved supply chain performance, reinforcing that facility-level data use can actually drive system-wide results. So next steps. So we'll continue the mentorship and follow-up visits, and we'll track changes in stock levels and present our findings at the data review forums. And the long-term vision is to focus on sustainability. So we are working to institutionalize the facility data reviews and secure logistical support and document lessons for scale-up. Leadership growth through the 4 pillars. So this project has transformed how I see leadership. I have learned that authentic leadership means trusting my voice and creating space for others to contribute. I have strengthened my strategic leadership, learning to see system gaps clearly and design solutions within real constraints. And most importantly, I have learned that leadership is not about controlling outcomes, rather about building capacity that endures. Thank you for the opportunity to present this work. I look forward to continuing this journey with WomenLift Health.